I was diagnosed with pernicious anemia in 2002. I was given a Schilling test, which is really old-fashioned. It's basically a urine test, and then it's got radiation in it or something. I don't really understand that. But what happened was the doctor seemed unable to explain to me what the result of the test was. I asked him, because I had read a little bit about it, I asked, do I have intrinsic factor? And he said, yes. But he was unable to explain whether that test was positive or negative. And I'll explain later why that's very important. So I was on B12 injections for 18 months. And then one day I said to him, do I need to be on injections? And he said, well, let's take a test. So they tested it, my injections were a level of 2,000. And he said, oh, it's sky high. And instead of just reducing the dose to maybe every 3 months, possibly, but having said that, I don't believe that that was the correct way forward with my particular disease, and that will be shown later. So instead of changing the dose, what he did was he took me entirely off injections. As a result, 3 years later, I collapsed with chest and pains in my legs after coming off a plane, and ended up in hospital. And they checked my blood and they could only find high clotting factor, and they put me on an ECG. They still said there was nothing wrong with my heart, but at the examination 2 weeks later, after they did a further heart test, I said to the doctor, I think I should be on B12 injections. And he went, oh my goodness. He said, okay, he said, I have to write to your GP about that because I think that's quite serious. So he wrote to my GP. And so fortunately, my GP assessed my situation. Now, I have to say that prior to collapsing, the young doctor of that surgery had put me on heart pills for chest pain and breathlessness 4 months earlier. So I was being given high-level heart pills, and in actual fact they make megaloblastic anemia, which is the big term for pernicious anemia, worse. So the older doctor was very shocked. He said, I have to get you an antibody test. And I said, fine, I don't know what that is, but that's fine. So the blood test came back. I went to see him, and he said to me, my goodness, he says, you're the first genuine case of pernicious anemia I have seen in the last 5 years. And he said, I'm putting on your notes that you have pernicious anemia, and I'm putting it on the front of your file in red. And he said, in fact, I'm going to bring the other doctor, the young doctor, into the room. And I said, fine. And the young doctor came in, and the older doctor, I don't want to give their names because I don't think it's fair. The older doctor said to the young man, she has come back with antibodies to peritoneal cells, so she has real pernicious anemia. The young doctor was very, very shocked, and the older doctor said to him, you have to be very, very careful now about other things that you diagnose her with, and you have to be very, very clear about it, and you've made a mistake. Well, that was good enough for me not to sue them, because they corrected the whole issue, and of course there would be a legal issue there. But the person who made the major blunder is the Scottish doctor. What I'm going to do about that, I don't know. I mean, it was a long time ago, and I spent the last 3 years just trying to get the correct dose of B12 in my system, because doctors have this thing against giving you what I believe to be the correct dose, which is once a month. I certainly feel better once a month. I'm more active, I can go to the gym, I can do things, and then by month 3 I'm tired, I get colds constantly, and I don't really have that great quality of life in month 3.